My name is Dawn Mechanic Hamilton, and I'm a clinical neuropsychologist at the Penn Memory Center at the University of Pennsylvania. And I co-lead the clinical core at the Penn Alzheimer's Disease Research Center and co-lead the ADRD pilot core at Penn AI Tech. Today I'm going to be talking about the use of remote cognitive digital assessment for determining change in cognition as we age or as we're at risk for neurodegenerative disease. As we age, there are changes in thinking that come to be expected. It may take a little longer to complete a task, or we may experience more word-finding pauses. These changes feel uncomfortable and frustrating, but in most cases are normal. In order to figure out if cognitive change is more than expected and an indication of a neurodegenerative process, we use standardized cognitive tests. They're typically paper and pencil tests that are done in the clinic of memory, language, attention, executive functioning, and visual spatial functioning. They're typically completed by trained testers and interpreted by neuropsychologists. This works well for those who can come into the clinic and are willing and able to engage in hours of testing. There's a lot of rich information that can be gleaned from the tests in order to inform diagnosis, prognosis, and treatment recommendations. However, there are also limitations, such as availability of specialty clinics and barriers to equitable healthcare. And digital mobile cognitive assessments may help to bridge the gaps in clinical care and research initiatives. There are three important issues to keep in mind when thinking about expanding accessibility and types of cognitive assessment tools to include digital solutions. One is that more older adults are using mobile technology than ever before. Two, remote assessment can decrease barriers to care and research engagement. And third, there are features of digital assessment that can enhance our understanding of cognitive change in typical aging and neurodegenerative diseases and add to our clinical toolbox. It used to be the case, even a few years ago, that there was a lot of skepticism about willingness of older adults to use technology in clinical care and research participation. Over the last 10 years, there has been a steady growth in smartphone ownership in all age groups, with a steep increase in those over 50. We now recognize that it can be an option in the right setting, especially if needed resources are provided to individuals. Importantly, access to some technologies more than others, like smartphones, show more equitable distribution across racial and ethnic groups, which in turn has the potential to provide more equitable opportunities for clinical care and research participation if we choose tools that are available. Now that more older adults are using mobile technologies, the availability of basic equipment opens the door to developing digital cognitive mobile assessment tools. We do have to keep in mind that rigorous testing of these tools is needed to produce tests that are reliable and valid for clinical and research use. In terms of benefits, mobile cognitive assessment can help to reach more patients and interested research participants in rural areas, expand availability of linguistically and culturally appropriate tools, collect data while a person is in their own home environment, reduce financial and time burden on patients and their care partners, while increasing the amount of data that is collected, connect patients, care partners, and clinical care teams more frequently through monitoring of remotely and frequently collected data, and increase the frequency of data collection to identify stability or change over time with greater ease. In addition to the benefits of reducing barriers with remote assessment, the digital assessment components take advantage of the technology features, such as the use of visual enhancements and audible alerts, the ability to capture several data streams, including trial-level data, reaction time, accuracy, and passively collected data on a smartphone. And additionally, digitized assessments can adjust to user performance to reduce time burden and to collect data on a greater range of performance. Mobile technology shows promise in adding to the tools available to reduce burden, carefully and reliably assess cognitive functioning, and remotely monitor for change in cognition in older adults and those at risk for or experiencing cognitive change. Thanks for watching. If you're interested in this topic, please visit the Penn AI Tech website.